Patients who have atrial fibrillation need to know that there are consequences to it if it's not appropriately treated. So ignoring atrial fibrillation is not a wise strategy. Why? Because the complications can occur. One, you can form clots in the upper chambers that can break off, go downstream, and cause a devastating stroke. No one wants a devastating stroke. No one wants to take anticoagulants either, but when you weigh those against each other, you have to stay compliant with the therapy to keep that from happening. Also, if the lower chambers are beating way too fast, they're going to wear out over time. Instead of being able to continue to do this, eventually they're just going to go like this, and you're going to be in profound heart failure. So the rate needs to be controlled, and if you're staying in AFib, you need to stay in anticoagulation. If we have you on medications to convert you into normal rhythm, you need to stay with those, or you're likely to go back into the atrial fibrillation and suffer those other consequences. So some people consider atrial fibrillation a nuisance disease, and yes, we have many tools to help control it and treat it, but you have to pay attention to it. You can't say, oh, it's just a nuisance, I'll ignore it. That decision would have devastating consequences. So what I want patients to know about AFib is there are many options available. You need to work with your physician, and you need to stay with it. Once you have AFib, you're likely to have problems with AFib for the remainder of your life.